absolutely. Yes. So see, everybody's starting to kick in now. So we're super excited to have Erica Jane joining us today and to be able to go through the Get Healthy platform, specifically for the Fast Track members and specifically for the Practice Plus module of the Get Healthy and above, to show you guys how to use that effectively for your programs and how to interact with your patients most efficiently and effectively to get patient outcomes. So yeah, just super excited that Erica could join us today. And yeah, let me hand it over to you, Erica, and we can go from there. That'll be great.
Fantastic. Hi, everyone. For those of you who don't know me, my name is Erica. I'm one of the founders of Healthy, and I see in our audience today we have a mix of people that already use the Healthy platform as well as those that are interested in just learning a little bit more. So my goal today is to run through the Healthy platform and show you what it's all about, as well as talk about some really exciting best practices and ways that we've seen our coaches really make the most of it and grow their practices and build client engagement. Before I dive into the platform, to introduce myself quickly, we actually got started with Healthy because I watched my own parents struggle with weight loss and prediabetes and so many of these health issues for 25 years growing up. And my parents started working with a nutritionist that they got access to through a corporate wellness program. Both of my parents lost 35 pounds each over the course of about a year. And so I watched that and I really said, well, look, there's something in nutrition that's not being met today. What is that? And so we started really talking to our providers, dietitians, health coaches, nutritionists, and found that the number one issue that our providers were really struggling with, it was kind of a chicken and the egg situation of they weren't able to work with as many clients as they wanted to or needed to. And as a result, clients weren't getting care. And it was because our providers and the providers that we really spoke with were struggling with the technology piece of how do you actually get a business off the ground to turn passion and enthusiasm and excitement into a business where you can consistently work with clients and spend as much time as possible building client relationships, focusing on outcomes, and leveraging your expertise to do so. So that's really just led to the Healthy platform. And I'm really excited to dive in and show you what it's all about, and then talk about what we've been up to with Garrick and Fast Track. I'd love to make this interactive and collaborative as much as possible. So even as I'm talking, please feel free to use the chat platform to message me, to message all panelists, whatever you're comfortable with. And we'll do a bit of a Q&A at the end, or even in between. I can pause at any time. Just let me know. Fantastic. So I'm going to go ahead and share my screen. All righty. Garrick, do we see Healthy here?
Yeah, absolutely. Perfect.
Fantastic. So our platform fundamentally splits into two sides. We have a side for you as the practitioner, and then we have a side for the clients that you work with as well. And Healthy is a website and a mobile app. So as part of the platform, you actually have access to your own mobile app that clients can sign into as well and engage with you virtually. So I just logged in as a provider. The first thing that you'll see here is a news feed. This can all be customized depending on how you in particular practice care. But you actually have the ability for clients to take pictures of their meals, and you can log and comment back and forth. They can also keep track of metrics, whatever you want to customize on the platform, which I'll get into in a second. We have the interactive chat capability, which is a very powerful tool if we think about ongoing engagement and accountability. Rather than giving out your personal email or your personal cell phone number to your clients for things as simple as logistics or, hey, I'm running 10 minutes late for my appointment, to ongoing accountability. You know what, I'm having a rough day. I want to just touch base about X, Y, and Z. The chat platform is actually one of our most utilized tools. I'm going to jump to the programs here, and this is actually one of the first primary ways that Garrick and Healthy have been collaborating. The programs feature enables you to build, distribute, and sell courses to your clients. So for example, if I create a 12-week functional nutrition overview, I can add a description, talk about the benefits, and even create a teaser video for my clients. I can then add different modules. Week 1, the fundamentals, and then set a day from which a client will receive a form, a video, a document, or an email that's really, really powerful and compelling. And then, of course, I can select what clients I want to enroll in that course. And I can also charge for this. So I can tie it to the client packages, which we'll jump to in a minute, where you can actually go ahead and set up all of your services, your store, what you're going to be offering, what you're going to be selling, and tying it all together. Before I move on, are there any questions about the chat, the programs, or any of that food logging? Okay, fantastic. The organization tab on Healthy, if any of you are thinking about going into business together or working with multiple providers, you're going to want to use the organization tab where y'all can manage multiple provider calendars and coordinate across within the Healthy platform. The clients tab here is fantastic because it's really the heart of Healthy when you're working with someone. For example, if I find my own profile in here, I can go in, I can view upcoming and past appointments with myself, take a look at financials, so you can actually, as a provider, securely store credit cards in this system, so you don't need to worry about a separate payment processor or anything like that, PayPal, Venmo, etc. View my food log, view metrics, and you can really customize what metrics you care about here. View selfies, view workouts, and also just look at different metrics in a graph format as well. See, we have some chat, so I'm going to take a look here. I don't have the organizational tab. So Allison, so organizational tab will show up if you have more than one provider. So if you want to set up your organization, you can actually do that right within the platform. If you go into the top right here and go into organization, you're going to see information on how to manage your memberships here and go ahead and add an organization, after which this tab will show up. Our next question is, with the programs, is there a way to discount for them, or do I have to create each program separately for full price, 10% and 15% discounts? Great question. So if I go to the billing client packages, let me actually just do a quick overview here. So philosophically, you can go in and create a package. So I'm going to go in and create a package here. I can put a name, a description, what it includes. So we'll jump into different appointment types. So for example, if you have follow-ups, you have initials, if you have group sessions, if you host monthly webinars and you want to incorporate that into a single package, you can do that here. And you can also tie a program into a package if you want, or keep it totally separate separate from another package. You know, multiple packages, and so there's some flexibility here. One of the great things about the packages system is that you can do recurring payments as well, which is what Leslie's question was, which is you can actually go in here and choose a billing frequency. You can create a one-time package for, let's say, $700, or you can do monthly payments of, let's call it $385 per month, number of billing periods until canceled, or you can run a 6-month program. Now, in terms of discounting, great question. We actually have a promo codes feature. So if you go to hear more You've connected your bank account. So once you connect your bank account, you're set. You can actually also use the promo codes feature to create and track promotion codes in the system. So if I want to do a promo code here and I want to do, you know, friends and family, you can do a % off or an amount off. If I'm going to do 10% off, applies to every payment or the first one you pick, and then you add the promo code. Relatedly, what's really nice is that you can actually use the client credit system in here, and you can tie appointment sessions. So if someone buys a 10-pack of sessions from you, then every time they book and show up for an appointment, it'll automatically deduct from their remaining sessions. Please continue asking questions about the payments and packages. I'm happy to go back to it. Dave asked a question about the chat. So the chat platform is actually my favorite feature on Healthy. Don't tell anyone, because I think it's just really powerful for engagement and ongoing accountability, which is so, so, so important for success. Couple of things with the chat platform. You can send one-on-one messages to a particular client. Topics can range from how are you doing, checking in, just want to make sure you're okay, to an inspirational quote. You can actually do message blasts, which are a BCC type of email where you can send one message to all of your clients or a subset of your clients, and then they can respond. It's available through the web platform, which is what I'm showing you here, as well as through the Healthy app. And I'll actually show you some of the Healthy app capabilities as well. But think of it akin to a Facebook Messenger, where it happens through the app or through the computer syncing in real time. Additionally, you and the clients both receive notifications through here, through push notifications, through email notifications at various points throughout your experiences. And you can actually turn on or off the frequency and the types of notifications that you'd like clients to receive and that you'd like to receive. Absolutely. Yeah. Keep the questions coming. It's super, super helpful to engage and just kind of understand how it all works. Okay. So the calendar platform is incredibly powerful and also designed to be simplistic and intuitive to use. Effectively covers everything that you really need in a calendar without extras. So if I go into here, I can go more appointment types, and I can actually set what appointment types I want my clients to be able to book. I can turn on or off the ability for clients to book with me. And I can put different types, different locations. I can set my weekly availability as well. And if I set up my weekly availability, then the times in green are when clients are able to book with me online. All of the appointment confirmations, the reminders, all of that is automated through the email and SMS. And then there are a whole bunch of additional appointment settings that you need to really think through and set up at the outset. On to the fun parts about the calendar. The calendar will actually sync with your website. So it'll sync with not only Google, iCal, and Outlook. If you use any external calendars to manage your life, like I do, I use Google Calendar. It'll also embed onto your website, so a client can stumble upon your website or to your social media platform or through an email marketing tool that you'll use. And you can then have them buy a package and book, buy a package, or just book an appointment. And I will actually show you on our blog, you can see different provider examples and figure out what's going to work best for your workflow and how you want that experience to look like. Can you customize the reminders? Yes, great question. So you can actually go into here, go to emails, and customize what you want the confirmation and reminder emails to say. And more detailed, if you have different types of appointments, so you have an initial, you have a follow-up, you have a group session, we have the default text show up automatically with the location, the time, the logistics, your name, But then you can add some additional text, like don't forget to bring this, this, and this. And then once you've set it, you can really just, it's automated. You don't have to touch it again. Relatedly, on our Practice Plus plan, which is what y'all will have, is that you can actually brand it with your logo, links to your social media. There, you can change the colors of this blue navigation bar to really make it fit the look of your business. So Leslie then asked the question, are you able to customize, I use this to book sales calls into my program. Great. With a follow-up of customized questions at the answer and it's sent back to you prepping for the call. Yes. So what I will show you is our intake form system. And this is where Garrick has actually already pre-created forms for Fast Track members. What we have here is a form builder system where you can go in and create an initial assessment, an e-signature form, a cancellation policy, a whole host of questions. Basically, I think of it as that stack of papers that you receive when you go to the doctor's office is all done online, and it actually pre-creates the client profile for you. So you don't need to then, okay, great, someone signs up on your website. Okay, great, first you go back and forth on a time to say, great, I'll talk to you tomorrow at 10. Then what you do is you email the stack of papers, and then they download them, print them out, or PDF them, or even film out online, and then scan them back, send them back to you, and then you're, great, stuck with a bunch of papers, and you're uploading it. And this basically streamlines all of that so that you set up your forms in the form builder here, created an intake flow, and then your clients receive the set of forms that you want them to receive. As soon as they book a call from your website, you get an email notification saying that they've booked an appointment, that they've sent out the welcome email, and then they'll receive your forms. So it's just all set up for you. And it's pretty flexible depending, again, on what you want your workflow to look like. Related to the intake forms, for example, if Ray booked with you, he would show up in this profile here. You would actually see his information pre-populated as he fills it out. And then you're able to go in and work with him on goals. You're able to chart on him. And once again, we have Fast Track recommended templates directly within the platform, so you're not starting from scratch. And then you can also view an archive of his previous notes as you work with him for more than one session. You can also, of course, upload private documents on him, like lab reports. He can upload and share documents with him, with you, however you want to provide care. And then, of course, here you can always view his personal information, his settings, insurance information, physician information, as well as adjust what you want him to track within the platform. Yes, for that, we have all of the IFM forms as well. So we had someone asked to get the IFM forms, we need to have them added to our account. So by default, what's going to happen after this webinar is that if you are part of Healthy, we are going to work with you to make sure. We've already been working with Garrick on what is the suite of forms that y'all will need to practice care. The IFM forms are absolutely included in that. And so you will provide access to them into your account. The documents platform is a way to actually think of it as a mini Dropbox or Google Drive. So as you accumulate handouts, recipes, best practices, news articles that you would traditionally print and share with a client or email, you can actually store them in here securely and choose to share them with your clients. If you are a current member since October, will you be able to access the fast track forms? Yes. So what we're going to be doing is running through the list of participants and making sure that you are set up with the fast track version of the Healthy platform, which Garrick has already been working really, really hard on in terms of making sure that we have the documents, programs, forms, and other resources to give you that head start rather than starting from scratch. I got a question around, can we upload videos? Yeah, that's actually a great question, because what you can do in the programs, Kathleen, I'm glad to hear that. I'm glad to hear that's awesome. So with programs, absolutely, you want to be able to upload videos and share them. So you actually sync them from YouTube or Vimeo rather than hosting them in Healthy themselves. So if you list them as unlisted in YouTube, so it's not that they're public or available to everyone, then you can just grab the link and pop it in there, and then the client will see it within the Healthy frame. They will not have to go to an external site to view it. All right, let's talk about telehealth for a second. So telehealth is basically virtual care, kind of like what we're doing now, where we actually have the ability to do a video call directly within the Healthy platform and through the mobile app, of course. The sound might get a little messy right here, so I'm going to keep this part short, but you can actually see clients kind of like what we are doing now. Client will appear where the apple is, and then you can take notes with them on the side that they will not see. Telehealth, even if you have an in-person practice, very, very powerful if there's bad weather, traffic, someone's sick, and you just need to do a quick check-in. It's secure, it's 100% HIPAA compliant, and it's built in, so there's no separate links, no separate reminders, no separate downloads or anything else like that. Relatedly, on the Practice Plus plan, you actually get a Zoom subscription built in, so you do not need to purchase a separate Zoom subscription for group webinars and group video chats. We have a special partnership with Zoom where we have a HIPAA compliant version built in, so you get their actually highest tier of Zoom subscription directly within Healthy. So please do not purchase Zoom on your own. You just won't need it. Awesome. So billing we talked about at a very high level, but I wanted to just showcase the fact that when you set up billing through Healthy, it's really built in. You add your bank account, set up different services and packages, and Garrick is going to be working with you guys on what are some of the best practices. I know that some of you are already using Healthy and have kind of talked through package options, but one of the things that we're going to be working with you on over the coming weeks and months as well is, what are we seeing work? What are we seeing as a price point that makes sense? What are we seeing as promo codes, best practices, and how do you actually grow your client base and generate revenue? Because it's really, really important to do that. For those of you that are coordinating with physicians' offices, you're going to need a fax line. So we have a built-in e-faxing line and platforms. You'll get your own fax line on the Practice Plus plan. And that enables you to send and receive faxes right through the platform. So you don't need to download, have a physical fax machine and do it. It's just all built in. And then reports is really, really powerful from more of that business perspective, where you can download at any point in time. You're going to want to see, how are your clients doing? How many appointments? Run finances. How much are you making? How much have you made this month? How much have you made last year? You can always also download a list of clients to then go in and link that to a MailChimp or a newsletter platform in order to build your email marketing list. And then here in the top right are really a lot of settings in terms of, customizing your brand, your name, your business's name, all of the emails, the entries that you want to include, notifications, really just helping you tie it all together. What billing service do we use? What's the credit card percent expense? Great question. So on the back end, we integrate with Stripe, which is a payment processor. They take 2.9% plus 30 cents. Unfortunately, I will tell you my personal perspective on the credit card payment processing industry. It's not something it's pretty standard. It's just an unfortunate reality. So we just find that our providers will add a few dollars to each of their packages to cover and absorb that cost. The nice thing about it is that's predictable. So Stripe does not distinguish the type of card that's used. They try and just keep it consistent across the board. I'm going to stop sharing my screen for a second, and then what we'll do is actually jump to, are the packages visible from your website as well, or is it a personal link you send to clients? Great question. So actually, I'll share my screen and then run through some example websites. On our help guide here, Kathleen, no worries, we're having to run. Previously scheduled client, we'll send over a recording and then be in touch with helping you out, but I am glad that you enjoyed this. So then if you go to the help guide here, you go to branding, we can actually take a look at provider example websites. So we see that different providers will think about their workflow a little differently. So you can actually showcase the Healthie features and platform on your website as a value add service that you offer to your clients, that you offer them an app. When they work with you, they can take pictures of their meals, they can message with you, they can book appointments on the go. There's a whole host of benefits, and we can give you the literature to help you out there so you're not starting from scratch. We also here have the ability for you to actually add links from your website to the Healthie platform. So that's a really nice one. And then, of course, you can do different permeations. If you want people to purchase a package before they book with you, great. Or if you want them to just book like a free consultation, that's a really popular one as well. There are a few different ways to do that. You can also have some packages be visible to clients while others are just private to you. Absolutely. Okay, I'm going to stop sharing my screen and just show you the app from my phone in particular. So let me go ahead and pull up the Healthie app, and I am logged in right now as a client. And so right here, you can see that I can take pictures of my meals. I posted, it's kind of got that Instagram feel for a client, which is really, really important. If you think about client engagement, you've got to figure out something that they're going to like and enjoy using. They can also securely message with you right through the platform. They can go in and book an appointment with your calendar that you've already put up, as well as view notifications. And then, of course, they can go in and do video calls with you from the go, view their goals, view their document, adjust their profile picture, things like that. When they enroll, is there a contract form you provide? Sophia, yes. So as part of this, we have, and Garrick also has, a series of forms, cancellation policies, HIPAA privacy policies, that you can take as a starting point so you're not starting from scratch. And then, of course, you can go in and modify it depending on your particular vision for your business. But our goal here is to help provide that solid footing. Additionally, one of the things that Fast Track and Healthie are going to be doing in the coming weeks and months is continuing to provide some ideas and best practices and, have deep dives on particular topics as you're working through all of these fundamentals.
Erica, I saw the refer and earn there. Can you explain a little bit about that?
Absolutely. So Garrick has been working with us to ensure that Fast Track members have an exclusive price and a little bit of a discount as well. So in terms of the plans and pricing, our Practice Plus plan is typically $129 a month, or for the year, it's typically $1380 for the year. Fast Track members are actually going to get the Practice Plus annual for $1242, so 10% off of our original price. Additionally, if you activate in the month of March, Healthie is offering a kickoff special of an additional $45 off of that Practice Plus annual plan. And our goal here is to say, we want you to get started. We want to help you. We also want to help you be really, really, really successful. And if you're on one of the other plans, but you need the programs and want to coordinate that with Garrick, then we'll go ahead and adjust your subscription on that as
well. Erica, can you explain when somebody starts to scale and build a team and they've got multiple practitioners that are working with one patient, how do they view documents and that type of thing? How's that work?
That's a great question. Yeah, so that goes into the philosophical point of you don't realize that the devil's in the details until you find the need to do that. So one of the nice things about the platform and how we've built the organization level within Healthie, it's actually just an added layer on top of the platform that you unlock when you need to. So for example, I'm going to share my screen again and jump over to Healthie. If I go to that organization tab, we actually have 30 different permissions that you can set when you're scaling up. So for examples, if I want to add a provider to my business, I'm going to want to think through a lot of logistics. So they may not be a full administrator, they may be an additional provider. They may only need a subset of permissions. Do you want them to, how do you want to think about client visibility? How are you going to share clients across? Do you want them to be able to see all clients or just their own? Are you going to be sharing clients and you have to have a primary provider or a secondary provider? How do you want to do appointments? Do you want to have the same appointment types? Do you want to have different appointment types? Do you want to changes that you make through the platform? Should that affect your additional providers? With the billing, how do you think through payments and contractor fees and bank accounts, and how do you want to adjust that? With other permissions, do you share a fax line or do you have your own fax line? Who gets notifications for what? Who gets custom metrics notifications for what? There are a whole series of permissions that we've really, really thought through to make sure that ramping up, and if you're at that point of scaling, then your number one goal is to bring providers on, bring clients on. We don't want you spending time finagling these settings. We've got you covered on that. Nadine, is it the same price for each additional practitioner? So the way that our group practice pricing works is that it's a price per additional practitioner, but it's actually a little less expensive than if you were to do it on your own. So for example, it's $149 a month for the first provider, and then it's an additional $50 per additional. So it's an additional $600 per year for the group for each additional provider on top of that. So if anyone's thinking about, going in together or thinking about that, we can definitely get you guys set up with a group practice account too. All right. So let's talk about some of the Fast Track, in particular, documents and resources and what happens next. So I know that some of us are already using the Healthie platform, already have accounts. For existing members, what we're going to be doing is that if you're on the Practice Plus plan, we have already started the process of adding the forms, the documents, the programs, and all of the materials that Garrick has provided to pre-populate your account. Awesome, that's in the works. For those of you who are looking to get started, what's going to happen is if you go into gethealthy.com, try it free, go ahead and get started, and I'm going to be on the lookout for your trial membership, and then I will give you a call and we will figure out how to get you guys set up and go in very, very quickly. If you're just adding a sales team and need shared calendar privileges, an additional $50 a month as well. Good question. No. So assistants do not count as providers. That's different. Okay, fantastic. So we have kind of gone through the platform at this point. I feel like this is honestly just the starting point, and the number one thing that Garrick and I want to do is offer continued ongoing support as we figure out a lot of these fundamental business questions, and also just ways to provide ongoing support to those of you as you really build and scale your businesses. I think it's really hard. I think that there's a lot going into it, and it's so, so powerful to have someone there to help you along the way. Is it user-friendly for non-tech clients on their end? Yeah. So this is actually something I didn't mention, but I think is actually really important. I think the number one tenet of Healthy is that Healthy's design and execution has to be as easy to understand as Facebook, Instagram, Google, and the apps that people are using every single day. Otherwise, you don't want to spend your day in a system that isn't fun and easy to use, and there's no way that clients are going to log in more than once. So the number one thing that we do is make it really, really easy for clients, even if you're not very tech savvy, to build and make the most of your platform. Otherwise, they're just not going to log in, right? And that's not fun. But it is so fun to see when clients are logging in, engaging with you, making the most of it. And quite frankly, from a business perspective, you can actually charge for that as part of a service offering, because you can offer concierge service, which is great. We're going to meet twice a week or twice a month for X dollars. But then on top of that, I also offer a concierge program where for an additional $45 a month, you get to post your entries, message with me, you set boundaries, but you're really engaging with them on the go as they need that support. View sample client pages. Yes. So I'm actually just going to send out this link in this chat to the sample provider websites. And what we're going to be doing in the coming weeks is sessions on particular deep dives, including one on setting up Healthy with your website. Exact same features as Zoom and webinar features. Yeah. So I'm actually using Healthy's version of Zoom right now. So what I'm doing right now is exactly what you'll get. Okay, great question. So one topic we did not offer, or I didn't really talk about, what I will right now, was insurance. So a great question. Healthy actually does have insurance capabilities in the platform. So if you go into here, you go to billing insurance, I'll run through some of the insurance capabilities. You can actually, I didn't save changes to my organization, but you can actually go in and create super bills. Right through the platform. You create a new super bill, information's all pre-populated in, you select the client, and then what you're able to do is add in details, NPI number, address, etc. It's all pre-filled once you've done it once, add diagnoses, codes, billing items, etc. All through the platform. Great, done. Email is already sent to your client. They go download and view it. CMS 1500 forms are also built into the platform. So if you're a physical therapist or anyone taking insurance, dietitian, even physician, you can go in here, generate a CMS 1500 form directly within the system. And then you can either generate the PDF raw form, or actually we sync with Office Ally very nicely. And so you can actually automatically submit claims through Office Ally, creating the claim in Healthy, and grab back the error code and the messages as well. So you use Office Ally, but you also use Healthy. And the advantage of it is that clients are already engaging and adding their data into the system. So you aren't manually going in and entering information into a separate clearinghouse. It's already there, done, updated, and good to go. Josh, do you have any additional questions about the insurance elements? I'm happy to delve into more of those details. Oh, so you can do group mastermind clients where multiple clients can see each other. Yes, that is correct. So just like what we're doing now, you can turn on or off the ability for clients, for participants to see each other. If you don't want that, then great, it's a webinar style. If you do want that, then just as Garrick and I are both facilitating this conversation right now, you can absolutely turn on the ability for clients to interact with each other. Okay, fantastic. So with that, what I'm gonna do is kind of run through some next steps, getting started, and ensuring that people are, y'all are set up, and then also just give out my personal information as well. And yeah, we have a lot of PTs who use the platform. Going back to the user friendliness, I think of Healthy as being an incredible tool for anyone who is working with the same client for more than one time. Traditional EHR platforms are meant for one-time episodic care for physicians who see hundreds of patients a week who never really see the same patient more than once. But if you're working with the same client more than once on a regular period, you absolutely need to use something like Healthy, where the client is engaged with you and a part of that journey. So not only does Healthy have that back office EHR capability that you need to run the business and get paid and do the scheduling and charting and things like that, then you also have the client engagement portal on top of that for the communication, the logging, the best practices, the outcome, the telehealth, the virtual care, the programs that are actually what drives solid healthcare outcomes. Yes, if you currently use Office Ally, we actually, because we sync nicely with Office Ally on the billing side, it's actually one of our most popular transition points, and we can actually import your charting and your patient data from Office Ally into Healthy, so you are not starting from scratch. Yeah. So here's what I'm going to do. If anyone is available, we have some time now or today. I have some time to kind of run through individual. I think a few of you have actually just messaged me privately saying questions on next steps. I'm going to send out my email message right here, gethealthy.com, Erica@gethealthy.com. And if you want to go to gethealthy.com, in the bottom right, there's our live chat. Our team is actually right here in New York. We're happy to answer any individual questions. Do you see my screen? No. I'll share my screen again to show you what that looks like. If you just go into here, gethealthy.com, click on this live chat and say hi, then that'll prompt, our team will just help you out. We're here and we're ready to help you get set up and answer any particular questions that you have. Fantastic, everyone. Well, thank you so much for joining. Really excited to get to know you more if I don't already, help you out. Excited for you to grow your business. It's really rewarding. It's got a lot of ups and downs, but you guys are going to thrive, and you're in really good hands with the Fast Track program.
Yeah, thank you, Erica. And I mean, for everybody, it's just about getting started. You know, there's so much to learn, but just get started, get the basics going. I think that is the whole point, is just taking action. And I think Get Healthy have really thought about everything. You know, they've covered everything. It's just an awesome platform, and that's why we've endorsed them from the start. So we're going to be doing more joint venture talks like this, just to help you get your practices going. So look for that communication coming through to you when we'll have that in place. But yeah, Erica, thank you again just for giving us that overview and giving people the head start to get going. So get onto Get Healthy website and just use the chat box to get started if you've got any questions. They've got a fantastic team to help. It's probably been one of the best supportive platforms that I've ever used. So you guys just use them, and they're going to help you to get your practice efficient and moving productively for a functional medicine practice.
Thank you so much for having me. Really excited. You know, we're a very genuine company trying to help our providers out. What Eric said is so important. In entrepreneurship and in business, you just got to get started. Take that jump, take that leap. You're going to figure it out. We're here to help you. It's not going to happen overnight, but the rewards will be worth it.
Absolutely. Thank you so much, Erica. Really appreciate your time, and we'll be looking forward to hearing from you again.
Absolutely. I'm online, so go ahead and message me and email me, and we'll go from there.
Fantastic.
Awesome. Take care, everyone. Have a great day.
Yeah.
Bye.